Hi, everyone. Good evening or good day, depending on what part of the world you are. I am excited today to welcome you to another episode of Masterminds with Dr. Tosin. And today we have a very important topic to discuss, something that is very important to all men. And good for us, we also have a very important personality to discuss this subject with us. There is obviously no better person to discuss. We will be talking about prostate enlargement today. Just going to have conversations at layman level about prostate enlargement. But there's really no better person to talk to us about this subject than, a urologist, basically. With me today, I have Dr. Henry. Dr. Henry is a urologist. He's a fellow of the African College and National College of Urologists. He's practiced in multiple countries, including Nigeria and in the Southeast Asia, or in Asia, basically. He's here today to talk to us about prostate cancer. You're welcome, Dr. Henry.
Thank you very much.
Yeah, thank you so much for agreeing to speak to us on this very important subject. Yeah. So I'm just going to be asking a few questions, but maybe I'll let you do a bit of introduction of yourself, just so that, because I think our viewers will want to know just a bit more about yourself, if that's okay.
Okay. Well, just like you've said, my name is Dr. Henry Njako. I am a consultant urologist. Like he has explained. And then, so also for the audience, urology is the aspect of medicine that deals with the reproductive system of the man and also the urinary tract of both the man and the woman. So urology is a surgical specialty. Anything affecting the reproductive system of the man and the urinary tract of the male and female. So today we'll be talking about the prostate gland, which is one of the reproductive organs that we find in the man. So I'm going to try as much as possible to bring it down to the basic level so that we understand as much as possible what is going to be discussed.
Yeah, thank you so much, Dr. Henry. And I've appealed to Dr. Henry to keep this really layman, to keep up to us, in just ways that we understand. I'm really looking forward to an exciting session. So, for starters, we mentioned it. We're going to be talking about prostate enlargement. What is prostate enlargement, Dr. Henry? What's prostate enlargement?
Okay, it's important before we talk about the enlargement to talk about what the prostate gland is itself, right? And it's one of the internal reproductive organs that we find in men. And, people have a lot of different notions about it, but we're going to try as much as possible. Like Dr. Tosin has said, I'm going to try to discuss it at the very basic level. So the prostate gland is something that is found in all men, right? And where it is positioned is just a small gland like the avocado pear. You see the nut that is inside the avocado pear. That is how the prostate gland normally should be. And it's usually found just underneath the bladder, right? Just underneath the bladder. So the bladder empties itself and goes right under. I have, like I promised Dr. Tosin, I'm going to share this so that Dr. Tosin, I hope you can see
Yes, I can.
I'm sharing.
Yes, I can.
Okay, so I brought out this picture so that everybody can understand what we are talking about. Over here, you would see the prostate gland right under the bladder. If you would, I don't know when I can get a pointer, 1 minute, so that you would see the prostate gland just right over here. Now, this is the normal prostate. You can see the bladder also. This is where urine enters in. And so urine goes through this prostate gland, comes out through this place. So I'm showing the normal picture so we can see the normal picture. And then I'll go to when the prostate gland is enlarged, what it is like. But this is basically what it is so that our viewers will understand what we are discussing today. So here is the prostate gland just under the bladder. So when this prostate gland gets enlarged, that is when we have this, an enlarged prostate. And if you look at this second picture, you will see that because of this enlargement, there is a push and the bladder has become smaller here than it was on this side. I don't know whether you can see what I'm showing now. Yes, so the bladder has become smaller on this side than at this side where the prostate gland is normal. So basically, an enlarged prostate, or what we medically will call BPH or BPE, benign prostate enlargement, is just that this gland, the prostate, has become bigger than normal and is causing some pressure or pushing back at the bladder and also obstructing the flow of urine through this place that will come out. So when we begin to talk about the symptoms, I hope that our viewers will be able to understand exactly what is going on with this picture that I've explained here. Thank you very much. Okay, I think we're going to...
All right, thank you so much, Dr. Henry. I feel like I'm back in class. To be honest, it's been a long time I've had to worry about the prostate. But I mean, it feels like I'm back in class and learning. So that's really good. Thank you so much. Just I guess our audience would also want to know, beyond trying to understand what the prostate gland itself is, what's prostate enlargement. I think one of the questions people will generally start asking is, am I at risk? Should I be worried? So I guess the next question I sort of just wanted to speak to is, what are the risk factors? Who are the people, or who should be sort of concerned about possibility of having prostate enlargement? I mean, obviously men, I suppose. Yeah, but yeah, just what are the risk factors? What are those things that can predispose people to prostate enlargement?
Okay. For prostate enlargement, like I've explained, it's one of the reproductive organs that is found in men, right? And from birth, when even in utero, that means when the child is still inside the womb of the mother, and that child happens to be a male child. Now, the testis begins to produce what we call testosterone. And this testosterone is what generally begins to form all the male organs that we see. As the child is born, the testis is still there, still functioning, still producing the testosterone. This testosterone also still acts and continues to act. The child gets to puberty, that is the boy now, gets to puberty, and we start seeing the secondary sexual characteristics. He starts growing beard, his voice starts deepening and all that. These are all effects of testosterone. So just like the testis keeps producing this testosterone every day, and it keeps acting on all the sexual organs of the men, this is also how it acts on the prostate. So one of the things that, causes the prostate to grow and grow is the presence of testosterone constantly being produced by the testes. So we see that as long as you are a man and you are producing testosterone, you have a functioning testis that is producing testosterone, this prostate gland will continue to be acted upon by the testosterone. So, but we know that at a certain age, because the prostate has been over and over and over, it's just like someone who lifts weight all the time, goes to the gym and lifts weight, at some certain point in time, you're going to see him developing muscles. Is that not so? You're going to see him coming more built. So this is the analogy to it, that as the man grows older, especially from age 40, 45, you will begin to see that there is a higher possibility that this prostate now begins to become bigger and bigger. Do you understand? So one of the risk factors really is the fact that you are growing older. And we cannot run away from growing older. I mean, when on your birthday, people will pray for long life and prosperity. I mean? So in essence, also they are praying that you will have a prostate problem, so to say. But that's on the lighter side. So that's just it. So advanced age is one of the risk factors. So you find out that it is commoner in older men from 40, 45, which is why we are always acknowledged. Any man that is above the age of 40, I know so many of us are going to be listening to this. Probably you are above the age of 40 as a man, or you are even a female listening to this. You have uncles, you have your dad, you have brothers, or whoever in your family who is above the age of 40. It's important that they begin to understand the importance of their prostate health generally. So, and today, since we are discussing about prostate enlargement, every man above the age of 40 should begin to. Actually, what I do for myself is that any of my birthdays, because for most men, and this is what I also counsel most of my patients who come to me, because these are days that you will never forget. I know men have a lot of things on their head, business, family, work, and all that, So there is a tendency to forget and all that. But every birthday, people are going to wish you happy birthday and say long life and prosperity, isn't it? So you should remember on your birthday that you should do something about your prostate. Because if you're above 40, like I've said, it means that prostate has the possibility of getting bigger and bigger. So I usually counsel my patients, or even the females that I meet, and tell your husband, tell your uncles, tell whoever it is, that on their birthday, they should. I know it's the day of celebration.
Celebrations, yeah.
So maybe the day after your birthday, so you do not forget. You go to see your urologist, you go to see your doctor to check your prostate health. So one of the risk factors, I'm going back to that again, is advanced age. Second risk factor that has been found is also family history. And I will talk about this because we find that, especially in the African communities or in the developing countries, we don't really have a good health record. So some people will tell you, oh, I don't know what happened to my father. I don't know what happened to my uncle. I don't know. So they don't even have a very good family history. But most times we find out that if there is a family history of prostate enlargement, it is possible that a patient can also develop that. So if there is a strong family history, especially for those in developing or even in developed countries, they should now know that they are also at risk of developing this. Then some people have talked about environmental and dietary factors and all that. Well, research studies have not really pinpointed if or not, but we found out that men, or especially Black men, are more predisposed to having a large prostate or bigger prostate than people in the Western countries and all that. The reasons are not yet exactly known, probably because they produce more testosterone, mean serum testosterone, than their other counterparts and all that. So yes, we find that, and we found very huge prostates in Black men, African Americans, Africans, and all that. So it's important that if you are listening to this as a person of color, you should take that seriously, and more importantly, and know that you should take care of your prostate because it is a risk factor to prostate enlargement.
All right, thank you so much, Dr. Henry. This is quite educative, and I believe that our listeners are learning a lot. They're learning a lot from this. If you are 40, or you're gonna be 40 anytime soon, even if you're gonna be 40 in another 20 years, you should think about, when you approach that age, that if there's nothing you're gonna take out. I mean, I know there's so much to take away from this session, but one sort of first lesson to learn is, once you're approaching 40, or even for our ladies listening to this, you have your husband, your spouse, your parents above the age of 40. It's important for them to start thinking about, looking at their prostate health, just like Dr. Henry has said. And I quite agree with you also on that issue of the black men that you've talked about. I think I mentioned to you at the point that I was doing some literature review on prostate issues, and it was one of the findings that we've talked about, especially among black men. So men of color, guys, take your prostate health seriously. But just sort of following up on that, I'm just also now thinking of what happens when, I'm thinking in terms of the complications now, before we start talking about what are the symptoms that these things might, so that people can start having ideas of what it might look like. But I also want to just also in terms of, since we're talking about the idea of looking after prostate health, what happens in terms of complications if we neglect these things? What are the possible complications of prostate cancer? Or maybe you can also talk about that in terms of the symptoms.
Okay, so I think yes, I would. I'll just go to the symptoms and then we'll go to the complications, because most times the men will come with the symptoms, and for some of them, they won't even know that this is becoming, or some people even assume that it is normal, so they just tell you, it's part of getting old or getting older and all that. So they sort of like stay back and they don't come to see the doctor until, from that symptom, they now start developing complications. So we're going to talk about that. Now, I'm going to go back again to that picture. And when I go back to that picture, I'm going to be describing a lot of things. So, and I'm going to take it step by step so that we understand. Here is the picture again.
Just wasn't sure about the cursor. It wasn't so obvious. So.
Okay, it wasn't showing.
Yeah.
Okay, and I was drawing. I didn't know. Okay, I don't know now. I'm going to try as much as I can, but we can see the.
Yes, I can see it.
Yes. Okay. 1 minute. You just give me 1 minute. Because I thought, okay, when I was drawing, I would need to know. Okay. So are you seeing any of my cursors now?
No.
Okay,
I'm not sure
why. Okay, please just because I'm trying to see how best please sorry for I don't know how this is going to happen now, because what I felt.
Would there be a way to describe it without the cursors?
Okay, let me try as much as possible. I'm going to try as much as possible to describe. But we are seeing. You can see the picture that we have. So I'm going to concentrate now on the picture on the right, where we have the enlarged prostate, so now we see that, like I explained, the this 1 minute, this prostate has now gotten bigger over here, right?
Yeah.
Now, and the primary place where it is causing a problem is on the bladder. And I mentioned the last time that the bladder has gotten smaller because, of course, the prostate has gotten bigger and pushed on the bladder. So before we go further, I need to tell us that the bladder basically has two functions. What the bladder does is to store urine and also to empty urine. So we are going to, I'm going to say it again. What the bladder does is to store urine. So it's going to take its time to get filled up. And when the bladder is filled up, it is going to try to empty that urine that has been stored, right? So when the prostate gets enlarged this way and reduces the capacity of the bladder or reduces the volume of the bladder, because you can see here that it is pushing on the bladder now. Yeah. So you see that the volume of the bladder itself has become reduced.
Yeah.
Isn't it? Yes. So now we have the two main problems, or two category of problems, which is storing and emptying. I'm going to start with storing. Now, what are the problems when it comes to storing? It means that because of the reduced volume of the bladder, any small urine that comes from the kidney into the bladder, there is very little space now. So the man who has the enlarged prostate will feel, oh, my bladder is already full. I have to go to the toilet as soon as possible to empty. But the problem is that if the capacity of the bladder used to be 200 mils, the prostate has reduced that capacity to 100, so to say. So any small urine that comes in, the patient feels that the bladder is full. So every now and then, sometimes 30 minutes, every 1 hour, they want to go to urinate. That is what we call frequency. So always going to the bathroom to pass urine. In fact, sometimes they are in board meetings, they are in the market, they are driving or traveling or whatever it is, and they always want to stop to urinate. Do you understand? So these are some of the symptoms that they will begin to notice. The second symptom, still under storage, is that immediately the person feels the urge to urinate, they cannot hold it. That means immediately they want to go to the bathroom to urinate, to void. Yes. So that means they have this urgent need to always rush or they would start feeling that if they don't go immediately, the urine is going to come out as soon as possible. That is what we call urgency. That means there is a strong desire to always go to urinate. That is urgency. Then, just like frequency, nocturia is that at night they find themselves waking up 2 times, 3 times, sometimes even up to 7 times just to urinate. That is called nocturia. And you would notice that this is one of the most troublesome symptoms. In fact, any patient that comes to me, the first thing I ask them is, how many times at night do you wake up to go and urinate? Yes. Why? Because nocturia is one of the most debilitating symptoms they have. If you are not able to sleep very well, it just shows that by the time you wake up the following morning, you are not refreshed, you have not rested well, you go to work, you are not concentrating, and all this because of your prostate problem. So as I'm saying this, I know some men are listening to me now, and they are realizing that this is some of the problems they are having. You know, concentration at work, concentration at wherever it is that they are. Why? Because they are not getting enough sleep. And why are they not getting enough sleep? Because they have to wake up all the time to go and urinate. So this is a very big problem for them. You understand? So then we have urge incontinence. Urge incontinence is that once they feel the urge to urinate, just like I talked about urgency, even before they get to the toilet or to the bathroom, they find that they have weed on themselves. In fact, anyway, this is the extreme part of it, and it can really, really be quite embarrassing. For the men, like I said, for the men that are listening to me and that are experiencing this, you understand what I'm talking about. And it really can be embarrassing. So this shows us that the bladder capacity to store urine is having a problem. That these are storage symptoms. Now we go to the second function of the bladder, which I said is emptying, which means the bladder is now full. Okay, let us empty the bladder. Now, in emptying, you would find that even though the man has the urgency to urinate, he runs to the bathroom to urinate. When he gets there, he still has to, in quotes, wait a little bit before the urine starts coming out. And it's paradoxical because this urine is trying to force itself out, and you are trying to run as much as you can to the nearest bathroom. Now you get to the bathroom, you still now have to wait and relax. Let me use that word. Now that I've said it, most of the men that are having these symptoms know what I'm talking about. They now have to wait and relax. This is what we call hesitancy, which is a difficulty in initiating urination. Do you understand? So that is hesitancy. So they still have to wait a bit. They have to allow themselves to relax. In fact, they will tell you, these men will tell you that, unless they relax, so this urine is not going to come out. So over time, they have learnt it by themselves that they just have to relax. Now, even when they relax, the urine now starts coming out. They also will notice that this urine is not coming out as much with much speed that it was coming out before. Let me throw our mind back now. I'm a local boy, so I grew up in the village and all that. And if you remember, in the village, I'm just speaking, I know some people will relate to what I'm saying. If there is a place that a new building is going on and they've come to heap sand and all that, you will find young boys. What they do is that they go to those heap of sand and they want to test who has the strongest stream of urine. So they bring out the pee and they wee into that sand. Usually it's quicksand. So they try to bore a hole into that sand and they try to see whose hole is deepest. These are, I'm sure some people are laughing now. That's what I'm saying. Yes. But what I'm trying to bring out here is that, as a young boy or as a young adult, they had a very strong stream of urine, which can bore a hole into the ground. But as this prostate problem starts, they find out that the urine stream is really, really now very poor. In fact, they have to stand very, very close to the water system, to the water closet, so that they don't spill their urine everywhere. Why? Because they have a poor stream. Do you understand? Now, that is the second symptoms they notice for the emptying symptoms. Now, in a bid to try to, make this poor stream to become stronger, what do? They now begin to push and to force themselves. This is what we call straining. So you see them, trying to strain the abdominal muscle, trying to push as if they are pushing something out, just to make that stream to become stronger than it is. Do you understand? So that's another symptom that they will notice. So these are the things that usually when a patient comes to us, we are going to ask them. And then even when the urine starts coming, sometimes it will stop, sometimes it will start, sometimes it will stop. So you find that the man spends a longer time now in the bathroom than before. Sometimes before he would just enter in 30 minutes, in 30 seconds, 1 minute maximum, he has finished urinating and he comes out immediately because the bladder empties. But now he knows that he cannot, he has to wait because sometimes the urine, as it is coming, it will stop. Then again, it will start. And he knows that if he leaves the bathroom, it's either he is going to run back again with that urge to urinate. So that's what we call intermittency. And it is a troubling symptom for some of our patients when they have this prostate problem. Then the last one is what we call terminal dribbling. And what happens here is that at the end of the urination, right, the last part of the bladder, if you look very closely, the last part of the bladder where you have this blue curve that is written urine. I don't know whether you're seeing where my cursor is going to, right? Yeah. So the last part of the bladder is called the trigone. This trigone is supposed to be the last part to push out urine, but the trigone has become weak over time. So the urine that is there just keeps coming out gradually. So the man actually thinks he has finished urinating, but what he finds is that terminal part of the urine now starts coming out. So sometimes his boxers are wet, his trousers are wet and all that. And any man that is listening to me now truly or has these symptoms understands what I'm saying. For those that do not have this symptom yet, I don't want you to have them before you go to see your doctor and to start to take care, yes, because it can be embarrassing, it can be troublesome most times and all that. So these are some of the immediate symptoms that a patient can have. Now, you asked about complications. So if over time, and like I said, some men believe that, this is normal, Jare, you are getting old, so it is normal. So they don't come to the doctor, they don't come to see the doctor. What happens is that as this obstruction of urine continues and continues, urine normally is produced by the kidneys and is brought down by the ureters. If you look here, I don't know whether you can see this pointer, right? That's the ureter that brings down urine from the kidneys. So, but if this obstruction continues over time, what starts happening is that the bladder begins to lose its ability to function properly. And this laxity in the bladder will transmit back to the kidney. And I always tell my patients this: anything as a urologist, anything that affects or gets to affect your kidney, please, as much as possible, you must avoid it. And anything that pushes back to affect, because some people have this, they don't take care of it, the pressure goes back to the kidney, damages the kidney. And we also know, like I was saying, some of these patients are elderly already, they are in their 50s, they are 60s, so probably they also even have other comorbidities like hypertension, like diabetes and all that. So those ones are already causing their damage on the kidney, right, if they are untreated. And then you are coming from below again with this problem from prostate. You see that the kidney is going to have very little chance to suffer. Right? And if the kidney becomes affected and the patient develops kidney failure, I mean, that is now another problem on its own. And this is something we want to avoid. So I hope I was able to describe that as effectively as possible. Yes.
Thank you so much, Dr. Henry. This has been a lecture, a very important one at that. Thank you so very much. And I'm sure our listeners are taking note of this sort of symptoms to look out for. We've talked about frequency, urgency. We've talked about nocturia. We've talked about hesitancy. We've talked about urge incontinence. I really just hope that, this is not to get people unnecessarily scared of every single thing that they see, but it's more so to get people to talk to your doctor once you notice these symptoms. Don't take them for granted. Talk to your doctor, talk to your urologist, basically. So just moving forward, just so that let's just move forward. In terms of, is there a way to prevent this? Is there a way to, and this will probably link to what you said earlier when you said look after your prostate health. Is there a way to prevent it, or is there a way to catch it early? You said look after your prostate health, go to your doctor. When we go to our doctors, what do we expect them to do? What do we expect of them? What are they likely to do for us, basically?
Okay. In the real sense of saying whether there is a way to prevent it, really no. And the reason I would say that is because if you remember, like I mentioned, one of the risk factors is getting older, advancing age. So as you get older, these will most likely happen. And I also even need to mention something here. Even the prostate does not even need to become big to give you these symptoms. Right? And I need to mention this now so that we understand. So sometimes we have seen patients who have come to us with these symptoms, and then we ask them to go do an ultrasound scan and all that. We find out that their prostate is not so enlarged, but they are having the symptoms. And the reason is understandable. The prostate gland itself is an interesting gland because it has two components to it. It has what we call the static component and the dynamic component to it, which means that your prostate could actually be the normal size, but it is overreacting, or it has the ability to contract and to react and to, be always in action, yes, so to say. So it's not exactly, so when you start noticing this symptom, you just go to see your doctor. Again, to answer the question, not really preventable. Some people have said, eat more tomatoes, eat this, eat that, and all that. Well, I don't know about that. But the point is, as long as you get older, these are bound to happen because, like I said, your prostate has been exposed to repeated doses of testosterone, yes, from your testes, right? So when you go to see your doctor, what your doctor does is to assess you and then ask you questions. Part of the questions is what we call the International Prostate Symptom Score. Now, these are a set of questions that will be asked to you, and especially for people that are educated, sometimes they would even give you the questionnaire and ask you to take it yourself. And for those who are not that educated, then the doctor can ask you in the language that you understand. They can ask you, okay, how many times do you go to urinate every 2 hours? You answer. How many times do you feel you cannot, in the past 1 month, how many times do you feel you cannot hold the urge to urinate and all that? So they ask you all these symptoms to ascertain where you are and give you a score. So the more your score, the more the symptoms you are having, or the more severe your symptoms are. Do you understand? So based on this, I'm even already going to the treatment options because it is based on
which is the next one we're getting to. So
okay, all right.
So I'm happy for you to talk about it if you want.
Okay, yes. So I'm just saying that why we are saying go for checkup, go to see your doctor, whether or not you are having this, is because maybe these symptoms might start, gradually, but because you are too busy with work, you are too busy with family business or whatever it is, you are putting it off. Gradually, the symptoms will become from mild to moderate to severe. So that's why it's better for you to go as soon as you begin to notice the symptoms. Now, so like I said, your doctor is going to ask you these questions, and then he's going to score you based on your answer to these questions from 0 to 35. The urologist knows what is that. So he's going to categorize you whether your symptoms are mild, or your symptoms are moderate, or your symptoms are severe. So based on this, that is now what will advise your doctor or will give your doctor a clue to the kind of treatment he's going to give you. If your symptoms are mild, sometimes he can tell you, okay, we're just going to observe and we're just going to see how these symptoms go. Please come back in another 1-2 months and we'll reassess again and see whether these symptoms have gotten worse or they are still the same and all that. This is what we call just observation of what's going on, right? Yes. So that's for mild symptoms. For moderate symptoms, your doctor is going to assess and see, are these symptoms really troublesome to you, Are they causing your quality of life to become less? Which means if you are in a meeting, do you always have to go out of the meeting and all that? That is embarrassing. If you are driving or you are in a transport or you are flying, some people have to take, if they are taking more than 2 hours flight, they have to, in fact, sometimes get a seat close to the toilet so that it can always So you see, this is embarrassing, no matter how you look at it. So the doctor is going to ascertain if this is even actually affecting your quality of life. Because as a man, you deserve to live a good quality of life, even if you have prostate problems, right? So these are the things your doctor is going to look at. And then he's going to know if he's going to start you on medications that will help to, reduce these symptoms, or to help you to contain these symptoms. Of course, even before then, he's going to do other tests that will help him. Probably he's going to examine you first. He's going to do a digital rectal examination. I know many men do not want to hear this, but that's important because it's important for the urologist to actually check your prostate. And let me show again the picture that we have been learning from. If you look at the second picture on the right, you would see that this is the rectum, and the prostate is very, very, very close. I don't know whether you can see my pointer.
We can't see it, but the rectum is towards the back, towards the right side.
Yes, towards the back here. And then the prostate is just very close. So what happens is that your doctor is going to do a digital rectal examination, insert his finger to feel your prostate. Now, this feeling of the prostate is going to tell him how is this prostate normal? Is it enlarged? If it is enlarged, is it symmetrically enlarged? Are there nodules in it? These are all the information that is left for the doctor to know or to ascertain. So this is important because after doing that, he's not going to send you for other tests for you to do, which is send you to do ultrasound scan, urine test and all that, blood test also to test the function of your kidneys and be sure that, that your prostate has not started causing problems to your kidneys. So when they do these barrages or when your doctor finishes these barrages of tests and you come back, and more also importantly, there is something we call the prostate specific antigen. I will tell every man, if you do not do anything for yourself, and I know men, they sacrifice a lot for their family, they sacrifice for their friends or whatever it is, but for themselves, they forget to take care of themselves. Yes. So if it is once a year, please meet your urologist. He's going to ask you all these questions. He's going to do a digital rectal examination for you and also ask for a PSA. This is very important. And again, I mentioned, especially in men of color. Because your PSA every year is almost like knowing, having the number of your cell phone number. It should be something that you know regularly or you should be acquainted with. The reason is because whatever is happening in a prostate, we usually see it as a reflection in your blood. And this is the PSA, which is what we call the prostate-specific antigen. So checking your prostate-specific antigen for every man, depending on your age, there is a range that is normal. If it is above that range, then we begin to suspect that something is happening, to that prostate. So your prostate is supposed to produce a PSA at a normal range. Once it is above that range, that is when we begin to know that, something is going wrong. So that is why it's important for every man, every year to do your PSA, go to see your doctor and all that, and that will help. So that's for moderate, whatever. If, as at now that you are listening to us and you are having all these symptoms that we have talked about, and even already having complications, one of the complications I failed to mention is what we call acute urine retention. That means that at some point, you now actually want to pass the urine, but you cannot, because there has become a closeness, as in the whole the pathway through which urine should come out from the bladder is totally locked up, and the urine refuses to come. And 2 hours, 3 hours, you have not been able to pass urine. It starts becoming painful because the bladder keeps accumulating that urine and you cannot pass it. It starts becoming painful and all that, and then you have to come to the hospital. So you see, I still tell men, if you refuse to come to the hospital willingly, then maybe one day, but we pray that doesn't happen. They will have to bring you to the whether against your will or not, and you don't want that to happen to you before you come to the hospital. So acute urine retention is also one of the complications that can happen with these prostate problems. Then the other one that is like not exactly like it is the chronic urine retention. And I'm going to say, and I'm going to describe it also. Sorry, I skipped this in the complications because we were out of time and all that. But it's important that I talk about it now that we've already mentioned it. Chronic urine retention is even worse. And the way because in acute urine retention, the patient has pain, and because of this pain, he has to come to the hospital. But in chronic urine retention, what happens is, and I'm going to describe it again for our viewers to understand. Now, the bladder is like a balloon. And if you get a new balloon, it's usually very difficult for you to blow a new balloon because it is new, isn't it? You have to put a lot of pressure, a lot of force to blowing a new balloon because it is new. But you notice, if you continue to blow this balloon over, you blow, you deflate, you blow, you deflate, you see that it becomes easier, isn't it? You now do not need as much force as possible. In fact, you can now blow the balloon as big as possible. That is how the bladder is. If there is obstruction to the bladder, at that first time, there is acute urine retention. So it becomes very difficult. The bladder is low. But over time, if the urine is accumulating and accumulating, the bladder keeps getting bigger. The bladder keeps getting bigger. So instead of the normal size of 300 to 500 mils that the bladder is supposed to have, the bladder keeps getting bigger because more urine is coming in and the patient does not even know. Then he's accumulating. Note that some of this urine is going back to the kidneys, but the patient is not having any pain. So he doesn't come to the hospital and he feels everything is okay. So chronic urine retention is even worse in the sense that over time, that bladder becomes as big as you can imagine, and then urine is always accumulating inside that place. Now, the patient can always have recurrent urinary tract infections, because accumulation of urine will always cause microorganism, bacteria to grow in this place. And so every time he's coming to the hospital, he's telling the doctor, anytime I go to urinate, I feel burning sensation, I feel this, I feel that, and all that. So these are some of the symptoms that or complications that can even arise from this prostate problem. Like Dr. Tosin has said, we're not saying this to scare you. We just want you to be educated or to know about it and know that if this is happening, you need to come to the hospital. So if by the time a patient comes to a urologist, he's already having complications, you know that this is not the patient that you are going to be giving tablets to manage his prostate problem, because now we are past the stage of observing, we are past the stage of tablets, we are now at the stage of probably doing a surgery on that prostate. And also, a lot of people also run away from surgery, run away from this. So it is important that as soon as possible, you present to your doctor so that your doctor can start assess you and know where your symptoms are and start the appropriate treatment for you.
Thank you so much, Dr. Henry, for this very educative session. We'll start wrapping things up shortly. Just a final question, and really, maybe not really a question. I just want to sort of give a final word in terms of, because there's a lot you've said, and I'm pretty sure our listeners have learned a lot. Apparently, if there are questions, please feel free to put questions in the comment section, in the comments, and then if more than happy to, I'll ask with Dr. Henry to see in terms of how we can get, if he's happy to maybe, release his email.
Yeah, no problem at all.
Okay, thank you.
Anytime I see the questions, as much as possible, I'm going to answer any question in the comment section. Yes.
Okay, thank you so much, Dr. Henry. So there's opportunity for us. And so the final thing I just wanted to talk about, just advise us. What should we do now? What should we do? I know you might have mentioned
it's not the end of the world. I want to believe that anybody that has listened to us, and really, thank you, Dr. Tosin, for this avenue and opportunity to, get this message across. So my final word on this is simple. As men, we need to do something for ourselves, and that is important. Like I've said, men sacrifice a lot for other people except for themselves. We rarely buy ourselves gifts. We rarely do things. So this is one thing you can do for yourself, and know that you are doing this for. So a regular checkup, like I mentioned again, if you want to follow my pattern or follow my plan, you will not forget your birthday. Or you can even tell your wife, your partner, whoever it is, your children, to always remind you on your birthday that you're supposed to see your urologist. If it is the day before your birthday or the day after your birthday, because of course you want to enjoy yourself and have fun on your birthday, that's okay, that's fine. So, but you always remember that at least once in a year, or for some people even once in 6 months, you should go see your doctor to evaluate you based on these things we're talking about. And if you already have symptoms, don't not to worry about it, not to be scared or disturbed. It's totally things that can be taken care of. So all you need to do is to present to your doctor. That's I think that's about it.
All right. Thank you so much, Dr. Henry. It's been very educative. I've learned a lot, and I'm sure our listeners have also learned a whole lot from this. And I do hope there will be a lot more engagement and conversation going forward. Just to note, I'm also going to hopefully be able to bring back Dr. Henry to speak about some other things, particularly some other issues similar, a bit close to prostate BPH, which is obviously prostate cancer. A lot of that's also another big topic. Hopefully we'll get Dr. Henry to talk about that on another video. In any case, thank you so much again, Doctor, for spending time with us today. We're really grateful for your time.
All right. Thank you very much. Thank you, viewers.
Thank you so much.